My name is Dr. Omi. It is the gallbladder and extra system in this lecture. So the gallbladder and the extra biliary system. So what is the anatomy of the gallbladder? The gallbladder is pear-shaped. It's a sac that is pear-shaped and has a volume of 30 to 50 mils. The gallbladder is located in the floor on the inferior surface of the liver. So it grows the visceral surface of the liver. Its main blood supply is by cystic artery, and cystic artery is a branch of the right hepatic artery. Mainly the artery located in the triangle of Carlot, which we will discuss. The gallbladder is drained by small veins that enter directly into the liver. Then there are lymph nodes at the neck of the gallbladder that drain it, and this eventually carries lymphatics to the hepatic. So this is the shaped sac, which we call gallbladder, and it has different parts. You can have the fundus, then this is the body, and before you get to the neck, and the mucosa of the gallbladder is thrown into folds, and it has a muscular coat before you get to the serous coat. So you have mucosa, which is lined by simple columnar epithelium with microvilli. Then you have muscular coat with smooth muscle cell and serous coat. So you have a face, the body, and the neck portion. This is the cystic, which usually has spiral folds. So the gallbladder is pear-shaped and lies to the right of the quadrate lobe. So it's to the right of the quadrate lobe in the gallbladder fossa, which is located on the visceral surface of the liver. What's the function of bile? It concentrates and stores bile. The gallbladder concentrates and stores bile, and remember, bile is secreted by the hepatocytes of the liver. So how is it able to concentrate and store bile? It's able to carry out ion transportation, so it's able to deal with the ion components of the bile, so it concentrates bile and later stores it. So we have called cholecystokinin. Cholecystokinin is a chemical that is produced by intestinal mucosal glands during digestion, and this endocrine substance passes to the gallbladder and causes the gallbladder to contract and release bile. So contracts and releases bile in response to cholecystokinin produced by the intestinal mucosa in digestion. So we've said the gallbladder has a fundus, body, and a neck, and the mucosa thrown into folds, spirals in the mucosal membrane at the gallbladder neck and the cystic duct form what you call the valves of Haystack. So the valves of Haystack are the spiral folds of the mucosal membrane. What are the relations of the bladder? Anterior superior, you have the gallbladder fossa being formed by the liver. Then you also have the fundus of the gallbladder that projects from the border of the liver. So where is the landmark of the fundus of gallbladder? What's the landmark on the anterior abdominal wall? So the fundus is located at the tip of the 9th costal cartilage, mid-clavicular line, where lateral edge of rectus abdominis meets the costal margin. So on the right side of the abdomen, where you have your 9th costal cartilage, so a mid-clavicular line, you have a portion where the lateral edge of right rectus abdominis muscle is in the 9th costal margin. That's where you locate the fundus of the gallbladder on the anterior abdominal wall. What are the posterior inferior relations of the gallbladder? So the neck is related to lesser omentum and the omental foramen, which is the epiploic foramen. This foramen lies immediately to the left. And then posterior inferiorly, the fundus is related with the transverse colon. What's the blood supply of gallbladder? Supplied by cystic artery, the right hepatic artery, and it's via the cystic vein or directly in the liver. So just a brief overview on the biliary tree. We said hepatitis produce bile. Then you have biliary canaliculi in the liver. Then you have bile ducts in the liver. Those are hepatic components. And out the liver, you have extrahepatic components of the biliary tree. You get to the common bile duct. So these biliary tree are supplied by gastroduodenal and hepatic arteries. So the bile ducts from the extrahepatic bile ducts are supplied by gastroduodenal, while the right hepatic artery. So how do you describe the biliary tree? We said bile is secreted by hepatocytes, Then would release this bile into biliary canaliculi. The biliary canaliculi will drain into interlobular bile ducts, and interlobular bile ducts will progressively form larger ducts. The interlobular ducts in the right lobe of the liver will form the right hepatic duct, the left will form left hepatic duct. So these two ducts, the right and left hepatic duct, will merge to form common hepatic duct, which is usually 4 centimeters. So this common hepatic duct will be joined by cystic duct from the side. Cystic duct is coming from the gallbladder. And together they form common bile duct, which is usually 8 to 10 meters long and 5 to 6 millimeters in diameter. This common duct runs in the free edge of less augmentum, then it passes posterior to the part of the duodenum and posterior to the head of the pancreas, then meets the pancreatic duct, the main pancreatic duct, and inserts at the ampulla of vata, which opens into the left side of the second part of the duodenum. So the posteromedial aspect side of the second part of the duodenum, the CBD unites with the main pancreatic to form the ampulla of vata, so called the hepatopancreatic ampulla. So this ampulla opens into the distinct part of the duodenum, and this ampulla of vata is located at the summit of the duodenal papilla. That is 8 to 10 centimeters from the pylorus of the stomach. What's the blood of the biliary duct? So arterial side, the proximal ducts are supplied by cystic artery. Then the middle part biliary duct, the common bile duct, the middle part common bile duct is supplied by right hepatic artery. Distally, common bile is supplied by posterior superior pancreaticoduodenal arteries. Remember, the pancreaticoduodenal arteries, superior pancreaticoduodenal arteries come from gastroduodenal artery, while the inferior pancreaticoduodenal come from superior mesenteric artery. So common duct properly supplied by cystic artery from right hepatic artery. The middle portion is supplied by right hepatic artery, and distally supplied by the posterior pancreaticoduodenal arteries, which are gastroduodenal artery. What's the venous drain of the common bile duct? It drains directly into the proximally, and distally it drains through superior pancreaticoduodenal vein. We have different lymph nodes that will drain the common bile. You have cystic lymph around the gallbladder. You have omental lymph nodes as well as hepatic lymph nodes. You have different variants of the biliary tree. You can have accessory hepatic ducts. Which may rise around in the liver and join any part of biliary tree. Then the right and left hepatic ducts may fail to unite. So you'll actually have double duct system when the right and left ducts fail to unite. Then the cystic duct can be absent, or the cystic duct can join common hepatic duct on the left rather than on the right. Remember, cystic duct usually joins towards the right. It can join on the left. Then it joins the right hepatic duct through an accessory duct. So you can have different variants of the cystic duct. So this image just shows you the different variants of the cystic duct. Okay, so you can appreciate this dilatation here. So this is at the ampulla of vata. So you have common bile duct and the main pancreatic duct opening, or you have the common bile duct and main pancreatic duct forming a dilatation before opening to the duodenum. So you can have both of them coming to drain at the duodenum, or they can drain separately at the second part of the duodenum, to each other or slightly away from each other. Then in this case, you can have an accessory pancreatic duct is the main pancreatic duct, the CBD. So again, this is just to appreciate the left and the right hepatic ducts joining to form common hepatic, which will be joined by cystic ducts from the right to form common bile duct that will be joined by pancreatic duct at the ampulla of vata on the posterior aspect of the part of the duodenum. So we have what we call Carlot's triangle. Carlot's triangle is formed by the inferior border of the liver superiorly, then inferiorly have that, and to the medial aspect, the common hepatic. So that's the Carlot triangle. Then from this image, you can see the left and the right lobes of this is the gallbladder. You can see the cystic artery coming from right hepatic artery, and the cystic duct is here. So right and left hepatic ducts forming common hepatic duct joined by cystic duct form common bile duct. So the Carlot triangle is also called Cystohepatic triangle. It's located at the porta hepatis, is the area of neurovascular structures in the liver. The boundaries are superiorly by inferior surface of the liver, then to the right by the cystic duct, and to the left or medially by the hepatic duct. So those are the boundaries. Inferior surface of the liver, cystic duct, and common hepatic duct. So inferior of the liver, superior, yeah. Then to the right you have your towards the right you have the cystic duct, and to the left you have common hepatic duct. So this is cystic duct here, and you have common hepatic duct. So inferior surface of the liver, cystic and common hepatic duct. Those are the boundaries of the Carlot triangle. What are the contents of Carlot's triangle? You have cystic artery, hepatic artery, lymph node of Lund. These are a group of lymph nodes that drain the gallbladder, and you have lymphatic vessels. So those are the contents. You have cystic artery, the right hepatic artery, cystic artery, and the lymph that drain the gallbladder and hepatic vessels. So what's the image? This Carlot triangle is surgically relevant because during laparoscopic cholecystectomy, when you want to remove the gallbladder, you have to dissect fully this Carlot triangle and be able to light vessels and prevent damage to vessels. So I get the Carlot triangle in imagine the liver, the cystic duct, and the hepatic duct. So there are various anomalies that may exist, like normal gallbladder or rudimentary gallbladder, dedicated gallbladder, or you can have accessory duct, or they are coming from different sources. Right hepatic artery, instead of coming from hepatic artery, it can come from supramesenteric artery, or you can have two right hepatic arteries, or cystic artery can come from left hepatic, or the common hepatic or gastroduodenal instead of coming from the right hepatic. So those are variants that may occur. So in this image, you can appreciate cystic artery coming from different source. Yeah? This cystic artery is coming left hepatic. This one is from the right hepatic. It can come from the central portion before common hepatic proper divides in right and left. So the different variants of origin of the cystic artery. And you can have a gallbladder being through cystic duct to the common hepatic duct, forming an angle, or it can come and they're joined together here, or you have a short cystic duct, or the cystic duct, instead of opening joining hepatic, it joins the right hepatic duct. Or for that curve, you can see these are different variants of cystic duct. So remember, the bile we've said is formed by the hepatocyte in the liver, 500 to 1,000 ml per day, and this production stimulated actually vagus nerve, and also stimulated when food enters the duodenum. So food enters the duodenum, bile production is stimulated. Production is also increased with stimulation of vagus nerve and secretion of secretin. So what are the components of bile? We have water, electrolytes, bile salts, bile pigments, protein, lipids. So bile has to emulsify fats. So 80% of cholesterol is absorbed in the ileum, and deconjugation of bile occurs, and later it will be absorbed in the colon. So 95% bile acid pool is actually reabsorbed in the enterohepatic circulation. So bile helps to emulsify fat, and after that it will be broken down in the small intestine, and 80% will be absorbed in the ileum. Deconjugation occurs, and later on absorbed in the colon. So this is you refer to as enterohepatic circulation, where 5% of bile pool is actually reabsorbed. So this just shows you what happens in the GI, in the terminal ileum, and final reabsorption of the bile salts. Thank you.